Good day, class. In the previous videos, we have studied the general introduction of the Chinese medicine formulae. In this video, we are going to continue the discussion on specific formulae. Firstly, we are going to introduce the Ethereal releasing formulae. When you see this title, you will realize this title is very similar to the title in the Materia Medica. One of the reasons is because these two, the Ethereal releasing formulae and the Ethereal releasing herbs, they have some connections. This group of the formulae, the ingredients in this group of the formulae are mostly from the Ethereal releasing herbs. So you will see many Ethereal releasing herbs in this category. In order to understand the Ethereal releasing formulae, firstly we need to understand what's the Ethereal releasing or what's an Ethereal syndrome. So the definition of this or the functions of this group of formulae has this group of formulae have the function to induce sweating, to relieve Ethereal pathogens. Through induced sweating, expel pathogens in the superficial level, so in the muscles or in the skin. It is used for they are used for treating Ethereal syndrome. So what kinds of syndrome are Ethereal syndromes? Or what kinds of symptoms are Ethereal syndrome? The patient may present as aversion to cold, fever, headache, general aching. So this general aching is the general body ache. Perspiration, absence of perspiration. Thin white coating, floating pulse. From this group of symptoms, the floating pulse is very important. Floating pulse can indicate Ethereal syndrome. A thin white coating, it can be thin white coating, it also can be thin yellow coating, but the coating must be thin. When the coating is thin, we can conclude that the pathogen is still in the superficial level. Once the coating becomes thick, the pathogen goes to the middle jaw, affects the spleen and the stomach. Though that's not Ethereal syndrome, it will become interior syndrome. The patient may present as perspiration or exams of perspiration. As you can see here, these two symptoms are complex. One is sweating, one is no sweat. Why the patient may present as sweating, while the other patient presents as no sweating, but both of them are considered as Ethereal syndromes. The patient presents perspiration is because the patient got deficiency in the superficial level. So the qi in the superficial level is not strong enough to hold or to confine the sweat in the body, to confine the body fluids in the body. That's the deficiency in the superficial level. The qi deficiency, more specifically, the qi deficiency in the superficial level. So the qi lost the function of confining body fluid. Then this patient presents as perspiration. In the other situation, absence of perspiration. This is due to the cold attack, coldness. The coldness has the characteristics of constriction. So it constricts the superficial level. The coldness constricts the superficial level. It closes the pores of the skin. So the patient presents as absence of perspiration. Very important in this situation is not abundance of qi. So we said perspiration is the qi deficiency in the superficial level. The absence of perspiration is not due to the abundance of qi, because if the patient presents as, or if the patient has abundance of qi in the body, the patient won't be sick. So the pathogenesis or mechanism of these two symptoms are very important. We need to identify. This also will affect your treatment. Although now we are talking about the formulae, if in the acupuncture treatment, when you see these two different symptoms, you're going to choose different acupoints as well as the treatment principles. For perspiration, due to qi deficiency, you're going to tonify the qi, such as stomach 36, the lung points, the lung back su points, fei su. So it's next to T3, the vertebra. So you can choose those. You also can use masturbation. You can use GP20 reinforcing technique. You can use masturbation. For absence of perspiration, you're going to relieve the coldness. You can use GP20, but in this situation, you will use reducing manipulation technique to relieve the pathogen. One is to tonify, but in the meantime, we also need to relieve the pathogen. So that's the combination of acupuncture and masturbation. For the absence of perspiration, you can use acupuncture. The patient presents as aversion to cold or fever, that's Ethereal symptoms. The first category in the Ethereal releasing formulae, we are going to talk about pungent and warm prescriptions. When you see pungent and warm prescriptions, when you think about the materia medica, you will understand that we have another category of pungent and cold prescriptions. Also can relieve the bacteria. These two different categories are used for two different types of bacterial syndrome. One is bacterial coldness, the other one is bacterial heat. So the pungent warm prescriptions are used for bacterial coldness. The first formula, mahwangtang, tang, the direct translation is decoction, so it's mahwang decoction. This formula comes from Sanhan Zabin Lun. This is one of the most important formula in Sanhan Zabin Lun. All Chinese medicine formulae use mahwangtang as the first formula we are going to study. In Chinese medicine literature, we also consider mahwangtang as the ancestor of the formulae. That's why we always discuss mahwangtang as the first formula. This formula comes from Sanhan Zabin Lun. It describes that a patient suffers from Taiyang disease. The patient presents as floating tense pulse, absence of perspiration, fever, body ache. This patient has been experiencing this problem for 8 to 9 days. The patient still presents as Ethereal syndrome. The author suggests that in this situation, we need to induce sweating. We need to use the sweating method to relieve the perspiration, to relieve the bacterial pathogen. After taking this formula, The patient may present as sweating. The patient also may present as fatigue. Some patients may present as nose bleeding. Once you see these symptoms, the patient will recover. In the other clause, the author, Zhang Zhongjing, also described as mahwangtang disease with floating tense pulse, fever, no sweating. If the patient presents as spontaneous nose bleeding, the disease will recover automatically. There's one more clause that discusses mahwangtang. The author described that a patient presents as floating tense pulse with no sweat, but the patient presents as bleeding. This bleeding can be nose bleeding or bleeding under the skin. In this situation, we also use mahwangtang. As you can see from these three clauses, the author emphasized the pulse, floating and tense pulse, no perspiration, absence of perspiration. The patient may present as bleeding, different type of bleeding. And when you see here, why the author will always emphasize bleeding. When you see from the theory, where does the blood comes from? Where does the sweat come from? The sweat is a kind of body fluid. Blood also a kind of body fluid. So now I want you to think about the relationship between the blood and body fluid. That's why the author introduced that when we see a patient, when we identify the disease, it becomes better or worse, we can see different symptoms. If the patient presents as bleeding or perspiration, we will see this patient is recovering. Either from the pathogen can go through either from the sweat or the bleeding. Mahwangtang consists of 4 ingredients: 麻黄、桂枝、杏仁、炙甘草。炙甘草 is actually 甘草, but this 甘草 is processed with honey. This formula is used for mahwangtang syndrome. Mahwangtang syndrome. What does it mean by mahwangtang syndrome? This is a group of symptoms that presents as Ethereal excess syndrome. This is very different from 桂枝汤, the next formula we are going to introduce. 桂枝汤, Ethereal deficiency syndrome. That's why I said qi deficiency in the superficial level. So mahwangtang is used for Ethereal excess syndrome. The patient may present as all these different symptoms. Described in 伤寒杂病论, the author said, whenever you see one symptom of this syndrome, you can identify this syndrome, you can use this formula. What does it mean by one symptom? For example, if you see absence or absence of perspiration, then you can identify this patient suffers from mahwangtang syndrome, and then you can use mahwangtang. That's how we use the formulae from 伤寒杂病论. Sometimes you may feel confused. How can we use one symptom to indicate the whole syndrome and use the formula? This is due to the treatment variation. Although we use one symptom to present the syndrome, we actually do not focus on the symptom itself. We actually focusing on the pathogenesis of this syndrome, the pathogenesis of the symptom. So when I say absence of perspiration, when I say this, we can use mahwangtang for axioms of perspiration. I actually referring to the absence of perspiration due to wind cold attack. So when you see some clauses in the text, especially in the classics, sometimes you will see the sentence, the author actually refers to the pathogenesis. So our treatments will based on the pathogenesis. That's why whenever you see essence of perspiration, you can use mahwangtang, because when you say essence of perspiration, you're actually referring to the pathogen, the pathogenesis of a wind cold attack. There are 4 ingredients in mahwangtang. How do they work? As we introduced previously, the ingredients in one formula, they don't just come randomly. They have some roles in the formula. The dominant, the assistants, mahwang. When we study the materia medica, we understand that the mahwang, the property is warm. So the warm property can be used for coldness. It can dispel the wind. It can be used for cold syndrome. Mahwang also pungent. It can disperse. Disperse can open the lungs, so it can cause sweating. That's specifically for actions of perspiration. It can be used to stop coughing. It can be used for improve urination. How does it work? Because of the lung. So this is the example we introduce in the materia medica. You think about the pot with the lid. You open the lid of a pot, the water can go out easier. The pot, when you open the lid, the water can come out easier, improving the urination. Mahwang is very light. It can go to upper jaw. It can be used to the lungs problem. So all these symptoms are either related to the lung or the itching skin, also related to the superficial skin. The lung or the lung system. The lung system refers to the whole respiration system, the nose, the throats, the lung, the airways. In order to perform the function of a wind cold to relieve the wind cold attack, in this situation, we can add 桂枝. It can strengthen or enhance the dispelling function of a wind cold attack. This is the mutual reinforcement relationship. 桂枝, warm, pungent, can be used for dispel coldness. It also can tonify the yang qi because of the warm property. When we study the materia medica, we assess that something pungent, something sweet can generate the yang qi. So that's the formula we use. Sweet, pungent, can generate yang qi. That's why how you can tonify yang qi. Sour, sweet, can generate yin. So that's the formula, the principles that we have introduced previously. In mahwangtang, mahwang and 桂枝have the mutual reinforcing relationship. So in order to enhance the function of dispelling wind cold of the mahwang, we will use 桂枝 together. The 桂枝 can assist the mahwang. 杏仁, slightly warm, it can dispel the cold. 杏仁 is bitter, so in in Mandarin we call it 苦杏仁, the full name of 杏仁. 苦杏仁, 苦 means bitter. Bitter 杏仁. Bitter can purge the qi, can be used for lung qi rebellion. Lung qi rebellion, the patient can present as coughing, tachypnea, rebellion. The lung qi is supposed to go down to the lung, to go down to the kidney as the kidney receives the qi. However, in this situation, the patient presents as lung qi rebellion. The qi goes outwards. The patient suffers from cough. So we can use something bitter to recover the lung qi, the function of lung qi. 甘草 warm and sweet, can harmonize the whole formula. Warm can dispel the coldness. So as you can see from here, the 4 ingredients of the mahwangtang, they are all warm in property. So they can be used for coldness. Some of them are pungent, so it can be used for releasing the Ethereal syndromes. When we use the whole formula together, especially mahuang and guizhi, when you use these two together, guizhi can enhance the perspiration function, reducing perspiration function of mahuang. That's why the patient may present as perspiration after taking this medicine, especially as it described in the 伤寒杂病论. After taking this medicine, the injection, after taking this medicine, we will require the patient to lie in a bed to cover with a duvet. And ideally, the patient may present as slightly sweating. So it's not severe sweat, slightly sweating. What kind of sweating is slightly sweating? The patient may feel sweat. You can feel moisture or humid on the skin. That's the purpose. We don't want to cause severe sweat. So that's the injection after mahwangtang. Guizhi and mahuang can be used to expel wind cold. Mutually reinforcing, these two, when used together, you can enhance the function. Regulate the lung qi. So we focus on the lung because this patient suffers from Ethereal syndrome in the superficial level in the lung, in the upper jaw. When you see this kind of formula, when we use the actual points, we also need to think about the points. We also need to think in this way. When you want to expel the wind cold, what can you use? Which points can you use? Such as GB20, large intestine 4. These can help you to expel wind cold. Especially can help you to expel the wind. GB20, 风池, Do16, 风府. We have explained previously in the class. 风 means the wind. The mention of the wind, the pull of the wind. So something have some points that have the name of 风, you can use to expel the wind. If a patient suffers from coldness, you can use the moxibustion. Or you can use the comprehensive manipulation technique to reduce the coldness. Regulating the lung qi. How can you regulate the lung qi? You can use the points on the lung meridian. You can use the front mu points of the lung. you can use the back through points of the lung to focus on the lung. So when you see, if you see the acupoints from this point of view, your prescription won't be too complicated. You choose 1 or 2 points to focus on, expanding the wing chord. You choose 1 or 2 points to regulate the lung qi, to regulate the coughing or tachypnea. So the principle, if you understand the principles of your formulae, no matter from herbal medicine or from acupoints, the formula will be very brief and efficacy will be good. So if you understand the principles of the formulae, your prescription will be very brief with good efficacy. So the pathogenesis is very important. The second formula, 桂枝汤, 桂枝 decoction. This formula also comes from 伤寒杂病论. Very similar symptom, the patient presents as Ethereal syndrome, but in this situation, the patient presents as floating weak pulse perspiration. After taking this formula, the patient is required to drink rice porridge in a warm bed or covered with duvet to induce slight perspiration. Still slight perspiration. Floating weak pulse, no thirst perspiration. Perspiration is due to the qi deficiency in the superficial level. With pungent and warm, induce sweat. Wing chord, it can be used for wing chord. It can be used for yang deficiency because pungent and sweat can generate yang, so it can be used for yang deficiency. It is also warm, also can be used for yang deficiency. Enters the lung, so it can be used for the lungs symptoms related to the lung. Reinforce yang qi. As you can see here, the ingredients, the herbs, the property, the action, and indications, they connect it one by one. If you memorize the properties of the 桂枝, pungent and sweet and warm, so you actually can analyze indications of 桂枝because of the pungent and warm. The pungent and sweet, so it can be used to generate yang qi, can be used yang deficiency. Because it's warm, it can be used wing cold attack. We go to the lung meridian. It can be used for sometimes related to the lung because it enters the kidney and liver. So if the patient presents as coldness in the kidney or liver, you also can use 桂枝 or 肉桂 or the cinnamon. So the difference between 桂枝 and 肉桂, 桂枝, 肉桂, the cinnamon, 桂枝they are from the same tree. 桂枝 is the small branches of the tree. 肉桂, cinnamon, is the bark of the tree. It can warm the liver and kidney, tonify yang qi. 白芍, sour and sweet. This is another principle that we have introduced just now. Sour and sweet can create yin. So now when you put all these ingredients together, you will see although there are only 5 ingredients, they actually have a good efficacy because these ingredients have a very strict function of each. 桂枝 pungent and sweet, 生姜 pungent warm, pungent sweet, pungent warm, pungent and sweet, 炙甘草 is honey, 甘草 already sweet, 八枣 dates also sweet. So we got a few ingredients pungent. We got a few ingredients sweet. Pungent and sweet can create the yang qi. 白芍 sour and sweet. Sour and sweet is two. It's three. When you see from the top four, if four together, then they can create yang. So you can be used for yang deficiency. When you see from the last three, 是甘草 dates, 白芍 sour and sweet. You can create yin. It can be used for yin deficiency. Where does the yin deficiency comes from? This yin deficiency can come from the body condition, the body type, the body constitution. It also can be due to the sweating, because this patient presents as sweating. Sweating, the fluid, the loss of body fluid will result in yin deficiency. So we can use something to tonify yin to create yin. So although in this formula there are only 5 ingredients, you can tonify the yang qi, you can tonify the yin qi. So when we can see this yin and yang together, we tonify on both sides. So from the theory, we says that Guizhitang can harmonize yin and yang, balance yin and yang. When we see from this perspective, we always need to consider the acupoints. We are focusing, our program is focusing on acupuncture. The purpose of studying the formulae, we need to think in this way, how to generate or how to formulate a prescription. What kinds of thoughts, what kinds of clinical thinking that we are going to use? Create yang qi. What can you use for creating yang qi? Such as some points, they have the function of creating yang qi, such as Ren 4, Ren 6, Stammer 36. Apart from these, you also can use the manipulation technique, reinforcing manipulation technique. It also can help you to generate the yang qi. You also may choose to use masturbation. How to create yin qi? You can choose some points, such as the spleen 6, spleen 9, yin ling quan. These can help you to generate the yin. So sometimes you can combine different points according to your need. These are the differences between mahwangtang and guizhitang. In this video, we will mainly discuss the mahwangtang and guizhitang. On the next video, we are going to discuss the modified mahwangtang. When mahwangtang has been modified, got another name for those formula. Thank you for your attention.